The purpose of this podcast is to present an overview of orthopedic or physical disabilities. Specifically, the podcast will present information on three areas: definition of orthopedic impairments under IDEA, causes for orthopedic impairments, and three ways of classifying orthopedic impairments, otherwise known as physical disabilities. Physical disabilities can exist as the only challenge a student faces or as one of several challenges. You may have noted that students with severe and multiple disabilities and other health impairments may also have physical impairments. Defining physical disabilities, orthopedic impairments. There's a good deal of confusion about the definition of physical disabilities. IDEA refers to physical disabilities as orthopedic impairments. Orthopedic impairment means a severe orthopedic impairment that adversely affects a child's educational performance. The term includes impairments caused by A. congenital anomaly, B. impairments caused by disease, and C. impairments from other causes. Although IDEA uses the term orthopedic impairments, special educators and state and local education agencies often use the term physical disabilities when referring to these same students. So there are two terms in use: the IDEA term and the practitioner's term. But special educators and special education agencies also refer to students with other health impairments or traumatic brain injury as having physical disabilities. So there is a problem of lumping together of many students with very different disabilities under one category. This podcast will focus on students who have disabilities related to their orthopedic systems, skeletal and related organs. Podcasts to follow will focus on specific orthopedic disabilities, in particular cerebral palsy, spina bifida, and muscular dystrophy. As previously stated, there is some confusion concerning definitions. There are, however, other confusing issues related to both causation and classification of physical disabilities, that is to say, orthopedic impairments. First, causation. IDEA's definition refers to three causes. 1. A disability caused by a congenital anomaly is one present at birth. However, it is not inherited from a parent. IDEA uses the example of clubfoot or missing a limb. A podcast to follow will describe one type of congenital anomaly, spina bifida. 2. A disability caused by a disease is a consequence of an infection or inherent weakness. IDEA uses the example of polio or bone tuberculosis, although both conditions are very rare today. A podcast to follow will describe spinal muscular atrophy, a hereditary condition. And 3, a disability caused by other causes is a catch-all category. Whatever is not congenital or disease-related derives from other causes. IDEA uses cerebral palsy, amputations, and bone fractures as examples of disabilities deriving from other causes. A podcast to follow will describe cerebral palsy. Pause and ask yourself the following question: what are three causes referred to by IDEA for orthopedic impairments? Give yourself a few seconds, and then this podcast will continue. Ways of classifying orthopedic impairments or physical disabilities. There are also 4 ways to classify physical disabilities or orthopedic impairments. They are neurological and musculoskeletal, progressive versus non-progressive, level of functioning, and limb involvement. We will take a brief look at each one. Neurological versus musculoskeletal. There are two common classifications of physical disabilities. Neurological, which refers to disabilities caused by or related to the nervous system, such as spina bifida and cerebral palsy, and musculoskeletal, which refers to disabilities caused by or related to the muscles and skeleton, such as with spinal muscular atrophy. Second way of classifying physical disabilities or orthopedic impairments is whether or not they are progressive or non-progressive. Some physical disabilities, such as the paralysis resulting from polio, may be non-progressive or non-degenerative, meaning the condition does not worsen. Others, such as a form of muscular dystrophy called Duchenne muscular dystrophy, are progressive and degenerative. The condition worsens over time and may even result in death at an early age. Another way of classifying physical disabilities or orthopedic impairments is by level of functioning. Physical disabilities in general differ according to the limits they impose on functioning. Persons considered to be mildly affected have little limitation of muscular activity. The quality of their motor movements and perceptual skills has the potential to improve or regress depending upon whether or not they pursue a course of therapy. Persons considered to be moderately affected require canes or wheelchairs and cannot meet all of their physical needs independently. Students with moderate physical disabilities may have awkward movements or difficulty seeing, hearing, speaking, or sensing. Finally, persons are considered to be severely affected when independent movement or communication is almost completely impeded. Head control is poor. Perceptual and sensory integrative needs prevent these students from achieving academic and age-appropriate motor skills. Lastly, physical disabilities or orthopedic impairments may be classified by the number of limbs involved. From the root plegia, from the Greek word meaning to strike, the terms hemiplegia, paraplegia, or quadriplegia refer to the body areas affected. Stop and ask yourself the following question. What are the 4 ways to classify orthopedic impairments? Thank you for your attention to this podcast.